Now I would request and I would get the photograph taken with all the eminent guests, including the Italian ambassador itself. To all the different cities and provinces of Pakistan, keeping in view the 18th Amendment that you also talked about.
Yeah, I think we were able to provide all of that to, much of that, I should say, to almost every situation that we encountered. The biggest difficulty, of course, initially, to claw back some of that, I don't want to use the word authority, but to claw back some of that coherence of that coordination required an effort. First in the form of NCOC, having a single body for a coordinating mechanism. But I can tell you that two things made it possible. One was scientific credibility, and the second was implementation. Because with time, as we saw that in the beginning, there was some discordance in that people had various ideas for various things, and people had projection studies coming out of various academic institutes all over the world, and had all sorts of fantastical and almost ridiculous numbers. And many of us who understood epidemiology then said, look, this is just mathematical extrapolation. People are not taking into account how epidemics actually evolve, because there is a biological side to all those stories. But eventually, the credibility, scientific credibility of what was being put out from the central mechanism, whether what infection control was, treatment protocols, prevention, projections. So I think we gained that credibility, and then this constant communication and reach out to the provincial entities. I think there was, on balance, it was a collective success to be able to do that. Every now and then, when you have a large country with 4 provinces and a couple of other countries, even somebody or the other will go on their plan. That's fine.
All right. What about the Italian experience, Professor Taliani? You talked about the second wave of COVID-19 that was extremely bad as far as Italy is concerned, and you talked about because this is 2,900 new cases per day that were emerging in the second wave. And of course, we all know that Italy was the second hardest hit in Europe after the United Kingdom because of COVID-19. What was the most important strategy that your government put into place in order to prevent further spread?
Well, of course, education first, because as the minister said, you have to educate people to have their own control of themselves. So wearing masks, maintaining the proper distance between people. And after that, there was a very hard decision taken by the current government to maintain a softer but still hard lockdown environment. There was not related to the business, epidemiological data. So data were examined day by day, and every day were decided areas where the strategy of controlling and implementing the lockdown strategy should be reinforced, and areas where it was possible to slowly reduce them. So it was a kind of compromise between the need for safety and the need for maintaining an economical way of life that was sustainable on the long distance. And this was really difficult because we were the first and most hit
fact that we've had these smart lockdowns in the past, but also currently as we speak, what needs to be done to make those people or public department understand that getting yourself vaccinated is one of the most important measures to be taken nowadays?
Right. So there's two sides to this. First, I don't think there is any, let's put it this way, there's always a certain amount of hesitation in any society or any intervention to get vaccinated. I mean, anything that we do, somebody will be other will come out and say, well, look, we don't want to do this. That's normal and natural. In any free society, people end up having their own views and opinions, people analyze things differently, they have doubts, etc., etc. And this is the process. But at present, as we're doing about 1 billion vaccine doses a day, so I don't think there's any dearth of people yet who are willing to be vaccinated. I used to use this term somewhat in relation of the willing. So the fact is that so long as you have tens of millions with the curve is always sigmoidal. You have a little beginning, a little hiccup at the beginning, then things pick up, and then eventually when you reach about 60-70% of the population, you start to have a slowdown for sure. So what needs to be done is continuous education, number one, debunking of all sorts of nonsensical theories, number two, and number three, a continued supply of these vaccines. Now you have currently 225 million people spread across cities and then smaller places and so on. The pipeline has to remain full. If at any point you may have enough vaccine in total, but if you have any areas where there are regional stockouts, that actually brings big hiccups into the vaccine requirement. So people then say, oh, we went there, we didn't get a vaccine. Now it might be 5 centers out of 5,000, but then this is how you struggle. So continued availability.
Because borders do not protect you from issues such as pandemics and climate change. For this purpose, today, IRS, in collaboration with the Italian Embassy and the Italian Agency for Development Cooperation, have organized this talk on the COVID pandemic, lessons from Italy and Pakistan. We have two very eminent speakers here today, the Special Assistant to the Prime Minister on Health, Dr. Faisal Sultan, and Professor of Infectious Diseases at Sapienza University of Rome, Dr. Gloria Galliano. Before we begin, I'd like to start with the recitation from the Holy Quran.
I would now like to invite the Italian ambassador to Pakistan to give his remarks to the audience.
Say that the institution can create the environment where a good technical exchange can take place. And since Italy and Pakistan are far but also share a lot of vision, a lot of values, a lot of and a great traditional friendship, I think it will be a very interesting event. The more, again, thanks to everybody for attending and for the organizers especially. Let's open the works.
I'd like to invite Ambassador Nadeem Riaz, President IRS, to give his opening remarks.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum and good morning to everyone. Honorable Minister, Professor Taliani, my dear friend Andrea, the Italian ambassador to Pakistan. Well, a few days ago, when I got to know that Professor Taliani is here, so I thought we must have an event. And that was basically for two reasons. The first reason was that during my 4.5-year stay in Italy as ambassador, I worked on a number of collaborations between Pakistani universities and institutions and between Italian universities and other organizations. I was also responsible for increasing the number of Pakistani students studying in Italy, and right now we have over 2,500 students studying all over Italy in various institutions. You would also be pleased to know that the Institute of Regional Studies has active collaboration with 2 Italian universities and with 1 Italian think tank with whom we participate on regular basis in events. Professor Taliani introduces herself as being from La Pienza University, but she worked and is still working in infectious diseases department of the Policlinico. And I have a special association with that particular outfit because I have been a patient there and I was monitored there for my leukemia for 4.5 years while I was there after my initial treatment and a bone marrow transplant in Paris at one of the premier institutions. So I know what the Institute of Infectious Diseases does. I know the level of health facilities in Italy. I know how technologically advanced they are. I was one of the few lucky people, I say lucky, Andrea, sorry for that, because I left just before the pandemic really hit Italy. I ended my assignment and I came to Pakistan, and it was only after that that things became bad in Italy. But due to the resilience of the Italian system, due to the work done by the professionals, Italy was able to bounce back from the pandemic, which really hit the Italian society very badly. We in Pakistan faced the pandemic and we are still facing it. And I think the most important thing is that we have to be vigilant. We have to exercise all the caution which is required, because it is something which, in my humble opinion, is not going to go away. It keeps on coming back in various variants. We could have had a very large event, but we did not, because we had to follow strict COVID protocol. So a lot of our listeners are online, and my request to all the audience would be that please follow the instructions which are given by the NCOC. Please follow the instructions which are given by your doctors, because this is something we have to fight. And we can only fight it not only with our families, collectively, but all countries of the world have to fight it together, because infectious diseases, pandemics, they do not have any international boundaries. They go across boundaries. Today we have 2 very distinguished panelists, and I will not take much of your time, and they will make their statements, but I think what we really learn from them is from their experiences and from their advice. Thank you very much for being here. Thank you very much, Minister, for being here. Thank you very much, Dr. Taliani. It's really a pleasure dealing with you again. Thank you very much.
Thank you, Pastor Riaz. Now I would like to hand the floor over to our moderator for today, Mr. Umar Khalid Butt.
Thank you, ladies and gentlemen. My name is Dr. Umar Khalid Butt, and 2 other doctors with me, Dr. Faisal Sultan and Dr. Gloria Taliani, who I interviewed the day before yesterday for my channel. And of course, Excellency Andreas Ferraris, to be here on part of such an august gathering, because we are talking about a disease that has engulfed the entire world, including Pakistan. The majority have been following the standard operating procedures. A lot of people have been vaccinated. We know the percentages in Islamabad, that is one of the highest as far as the people who've been given both the jabs of the vaccines is concerned, and also, of course, as far as the following the standard operating procedures is concerned. And of course, I think it's almost 70%, Dr. Faisal Sultan, of the people in Islamabad who've been given the first dose of COVID-19. A lot of question marks also are there as far as whether we need to be given the booster dose as well. Of course, a lot of studies are going on as we speak about this. But nevertheless, what is very important is not only that we need to be vigilant, because of, as Ambassador Nadeem Riaz also said, that there are going to be variants now, and these variants are going to come and go. We've had the Delta and the Delta Plus. We're going to have the Mu variant. that everybody is talking about, and there will be a lot of variants in the coming years as well. When I was interviewing Professor Gloria Taliani the day before yesterday, we talked about how long this COVID or this pandemic is supposed to remain across the world. And her response was more than 10 years, maybe 15 years, if I'm not wrong, Professor. The thing is that we will have to live with it, the whole generation will have to live with COVID-19. And this will be a part of our daily lives, and the most important thing, as has been enunciated time and again by Dr. Faisal Sultan in all of his media encounters, and we've covered a lot of them over time, that we need to be extremely vigilant. We don't know who has COVID, who doesn't, and it is only with time that we will understand how to really take care of ourselves and our loved ones. It does not differentiate between classes or between age groups and between, of course, different races or genders, or who's in front of you and who's not. There's nobody, even if you've gotten the vaccine once or twice, is not you cannot really say with a surety or assurance that that person is not going to get COVID again. We've heard of so many cases who've had it. Of course, the symptoms are less severe. Nevertheless, we need to be extremely cautious, and we need to be also observant of what goes on around us. Well, if we could now request our chief guest for the day, if it's already the time. All right. So I'll now introduce a person who, inshallah, if I get the opportunity, would love to interview in the coming days about COVID-19 as well. He is a Special Assistant to the Prime Minister on National Health Services Regulation and Coordinations since August of last year. He's also the Prime Minister's focal person on COVID-19, and of course, as we all know, a frontline warrior. We've heard him so many times talking about the SOPs, talking about the vaccinations, talking about the different procedures and the measures that have been taken by the government. Today, if I'm not wrong, the education institutions are also opening up, as Mr. Shafqat Mahmood has said. So, of course, the people need to be extremely vigilant there as well, the students especially, and the teachers as well. Without further ado, because I'm taking a lot of time, Dr. Faisal Sultan, ladies and gentlemen.
Masters, ladies and gentlemen, Professor, I'm going to switch in Urdu for a little while anyway, but we'll talk about the gist of what I'm going to say in English as well, so it all gets through. ख़वातीन हज़रात, आपकी मौजूदगी का, आपकी आमद का शुक्रिया। पाकिस्तान एक इंतहाई ये अहम मौका है कि हमारे पास एक बहुत सीनियर तालिबी प्रोफेसर मौजूद हैं जो इन्फेक्शियस डिजीज़ की एक्सपर्ट्स हैं, और जैसे एम्बेसडर नदीम ने बताया कि वो इटली की एक बहुत अहम इन्फेक्शियस डिजीज़ इंस्टीट्यूट, यानी एक ऐसा इदारा जहाँ मुतअद्दी अमराज का इलाज और उसकी मैनेजमेंट होती है, उधर काम करती हैं। तो हम समझते हैं कि उनकी मौजूदगी हमारे यहाँ, और जो वो अपने एक्सपीरियंसेस, अपने मुशाहिदात और जो अपनी सक्सेसेस है वो हमें बताएंगी, तो उससे कुछ हम सीखेंगे, और मुमकिन है कि कुछ अपने हमारी पाकिस्तान में जो स्ट्रेटजी रही है उसके बारे में अगर हम बात करेंगे तो मुमकिन है कुछ उससे लर्निंग उनके लिए भी हो। पाकिस्तान की जो कोविड या कोरोना स्ट्रेटजी है उसकी 3-4 अहम नुकात रहे। पहली चीज़ ये थी कि जो ओवरआर्चिंग स्ट्रेटजी थी, यानी जो मेन अप्रोच थी, उसका ताल्लुक़ इस बात से था कि हमने सबको साथ लेके चलना। ये इस वबा के साथ मुकाबला जो है वो कोई अकेला शख्स नहीं कर सकता। इन अदर वर्ड्स, it had to be a collective response that served the interest of the entire country, and you had to take everybody along. That was the first pillar. दूसरा अहम सतून जो था इस चीज़ का वो ये था कि इस चीज़ को करने के लिए हमें एक ऐसी जगह चाहिए, एक व्हीकल चाहिए, एक जगह चाहिए जिसमें मुशावरत हो सके और इकट्ठे फैसले हो सकें जो अकल और दानिश और साइंस पे बेस्ड हो। So the second pillar was to actually have a place where you could have collective, science-based, data-driven decisions, which could then inform your policy. The third thing was to ensure that तीसरी जो अहम सतून था वो ये था कि इस सारी चीज़ में
اس کو کرنے کے لیے جو اپروچ تھی، فیصلہ سازی تو ایک کمرے میں آپ کر لیں، لیکن جو اس کے ساتھ اس کو امپلیمنٹیشن کی اپروچ تھی وہ بھی تمام ملک میں موجود ہو، تمام ملک سے رابطے میں ہو، اور ایک نظم و ضبط اور رابطے کے ذریعے کی جائے. So in other words, the next pillar was very important, which was that not only the decision making had to be central and connected and data driven, but at the same time the response had to be coherent, coordinated, and essentially an all of the country approach to the problem. So these were some of the important pillars that defined then the further actions and goals that were driven. اچھا، اس میں ایک وقت اور دور تھا جب کہ جو ٹیسٹ تھے، جو بیماری کی موجودگی تھی، اس کی ڈیٹیکشن تھی، اس کے لیے لیبس ہوں، وہ کنیکٹڈ ہوں، آپ کو روزانہ کی بیسس پر، ڈیلی بیسس پر ایکوریٹ ایپیڈیمیالوجی یعنی اعداد و شمار روزانہ آپ کو ملے اور وہ مستند بھی ہوں. اس سارے سسٹم کو بلڈ کرنے کی ضرورت پڑی، کیونکہ 18ویں ترمیم کے بعد بہت سے ہیلتھ کے معاملات جو ہیں وہ ڈیوالو ہو چکے ہوئے تھے. پھر آپ نے اپنے ہیلتھ سسٹم کو اپ گریڈ کرنا تھا اور تیار کرنا تھا، چاہے ماسک تھے، پروٹیکٹیو اکوپمنٹ تھا. آپ کو یاد ہوگا ایک وقت پہ اس چیز کا بہت شور تھا. ہیلتھ سسٹم کے اندر آکسیجن، اسٹاف، وینٹیلیٹرز، بیڈز، ٹریننگ، ان کی آپس کی کوآرڈینیشن، یہ وہ تمام چیزیں تھیں جن کی تیاری کرنی تھی. اور آپ کو یہ اندازہ ہوگا کہ 66% انکریز تھا آکسیجن کی کیپیسٹی میں جب ہم نے پہلی ویو گزاری. اسی طرح بیڈز کے اندر ہزاروں بیڈ سسٹم کے اندر ایڈ کیے گئے. ڈاکٹرز، نرسز، باقی ٹیکنیکل سٹاف کو ٹرین اور تیار کیا گیا. پھر جو اس کے علاوہ اہم چیزیں تھیں وہ یہ تھیں کہ اس بیماری اور وبا کے دوران جو آپ نے انٹرونشنز کرنی تھی، جن کو NPIs بولتے ہیں، ان کو آپ نے ایسا بنانا تھا جو ڈویبل ہوں، لیکن اس کے دوران اور وہ بیلنسڈ ہوں، وہ بیماری کو بھی روکیں لیکن وہ اتنی ٹیلرڈ ہوں، اتنی نوانسڈ ہوں، اتنی ٹارگیٹڈ ہوں، ان کا ایسا طریقہ کار ہو کہ وہ سارے معاشرے کا گلا نہ گھونٹ دیں، بلکہ معاشرے کی جو زندگی ہے اور معاشی اور معاشرتی زندگی جو ہے وہ چلتی رہے، لیکن بیماری کا رکاوٹ ہو. اب اس کے اندر وہ اسمارٹ لاک ڈاؤنز اور ٹارگیٹڈ لاک ڈاؤنز اور کیلیبریٹڈ اپروچ جو تھی وہ شامل تھی. پھر مرحلہ آیا لوگوں کی مدد کرنے کا. سو احساس پروگرام کے ذریعے وہ معاشرے کے حصے جو سب سے زیادہ امپیکٹڈ تھے ان کو کیش کے ڈسبرسمنٹس دی گئی. پھر ویکسین کا مرحلہ آیا، اور ویکسین میں بہت اہم تھا. جہاں آپ نے 220 ملین لوگوں کا ملک یا 225 ملین لوگوں کے ملک میں ویکسین کرنی ہے. سو ویکسینیشن ان اے کنٹری آف 225 ملین پیپل meant that it had to be based on hard data, it had to be documented well, it had to have the kind of coordination and reach and build up of the vaccination system which did not exist before. ہمارے ہاں جو ویکسینز لگ رہی تھیں that was conventionally بچوں کے لیے ویکسینز تھیں. The vaccine system was geared for children. To actually retool and re-gear it for adult vaccination was another challenge. تو اس میں بھی ہم نے فائدہ اٹھایا اپنی نادرا کا، ہم نے فائدہ اٹھایا انفارمیشن ٹیکنالوجی کا، اور فائدہ اٹھایا اس کلیکٹیو ڈیسیجن میکنگ کا جس کے ذریعے یہ ریچ ہو سکتی تھی. تو آج ہم اس موقع پہ بیٹھے ہیں کہ ہم بتا سکتے ہیں، آپ اپنا CNIC دیں تو میں آپ کو بتا سکتا ہوں کہ آپ کو ویکسین لگی، 1 لگی، 2 لگیں، اور پھر ہم اس کے ساتھ جو دیگر ڈیٹا اور انالیسس ہے ویکسین بریک تھروز کے اور دوسرے وہ بھی کرنے آسان ہو. یہ ایک بڑا 5 منٹ کا ایک تیزی سے فاسٹ فارورڈ قسم کا سمری تھی، ایک جائزہ تھا جو کہ ہماری ویکسین اسٹریٹجی، ہماری کووڈ اسٹریٹجی جو تھی، جو اس کے بارے میں نے بیان کیا. میں پھر معذرت چاہتا ہوں کہ بیچ میں انگریزی اور اردو میں بات کرتا رہا، کیونکہ ہمارے گیسٹ جو ہیں ان کو اردو نہیں آتی، اور ضروری تھا کہ کچھ اس کے جو کی معاملات ہیں ہمارے اسٹریٹجی کے وہ ان کو بتا دیں. Again, I do apologize. I've had to switch between Urdu and English because we have the media there, and I want our words to get out to the public as well, and for a reminder of what the key components of our strategy have been and how we've actually put it into action, all the way from data collection and preparation of the health system and oxygen capabilities and capacities, to coordination, to smart, sensible, data-driven NPIs that were balanced and sustainable, and then a vaccine strategy that is truly equitable, fair, and across the country, and actually serves a very large country which actually faced difficulties in the beginning in terms of procurement because COVAX was slow to pick up at the beginning. Now, of course, we have a much better situation. So overall, I think I found myself as an infectious diseases physician, as a clinical infectious diseases physician. Like you, most infectious disease physicians like us have an epidemiologic interest by definition. And so I found myself in this very strange position of being in the center of the storm, in the eye of the storm, in a big storm which God knows will last how long, as you were saying. To be able to help and inform the national decision making in making decisions that were scientifically correct, yet were rooted in reality and were sustainable. And so it's been a privilege, an absolute privilege, I would say. This is something that one must be thankful for having the opportunity to contribute. So here I am talking to all of you smart and wise people to share our experiences. And we hope that we will be able to see the end of this. People keep asking me as well, just like you. And depending on the mood and flavor of data that I have seen, my decisions get affected by that. So I will not make my prediction. We have you here to make all the important predictions on the COVID pandemic. But for all the predictions, one must also look at the history of this, the science of this, the biology of this, how and where variants arise, where do they get stabilized, and how vaccines in fact get into impacting this. So again, I'm very grateful to Ambassador Naveen, to you, to our Italian colleagues, and Excellency the Ambassador, as well as our professional colleagues for being here and to helping us getting an insight into the Italian COVID strategy, as well as any novel ideas that we would hear. Thank you very much.
Strategy in Pakistan has implicated across the country. आपने उनको सुना, उर्दू में भी सुना, अंग्रेजी में सुना, मैंने कहा थोड़ी मैं भी उर्दू बोलूं। पाकिस्तान का ताल्लुक है, हम काफ़ी हद तक बचे रहे और मुख्तलिफ ममालिक को अगर हम देखें, उनका मवाजना करें, लेकिन उसका जो बेसिक उसकी वजह है वो ना सिर्फ ये है कि हमारी हुकूमत ने एक मुल्क में कोविड-19 उस तरह से नहीं फैला जिस तरह से फैल सकता था, जिस तरह से हमारे साथ के ममालिक में, अगर आप हिंदुस्तान को देख लें और ममालिक को देख लें, जिस तरह वहाँ पर फैला, उस तरह से पाकिस्तान में नहीं फैला। और उसकी बेसिक वजह ये है कि हमारे पास डॉक्टर फैसल सुल्तान और उन जैसे बहुत सारे ऐसे माहिरीन थे जिन्होंने एक कोऑर्डिनेटेड एफर्ट के थ्रू जो है हमारे मुल्क को एक बहुत बड़े डिज़ास्टर से बचाया, especially in the wake of COVID-19. Now, without further ado, let me introduce to you our Italian guest, who is here all the way from the University of Sapienza. She is an infectious diseases expert. She's also a professor who understands COVID much more than so many of us do. And I've had the privilege of talking to her extensively a few days back, and you'll be seeing that in my show in a couple of days. Without further ado, Professor Dr. Gloria Taliani.
Good morning to everyone. I have to admit that very much honored and happy to be here. I thank the Italian ambassador for being here. I thank Ambassador Riaz for inviting me. And I'm most grateful to the Minister of Health for being with us and sharing our experiences. I have prepared some slides, not just to tell you the story of COVID, because it's not necessary. All of us know it very well, unfortunately. But just to share with you our experience. And just to start, I would like to say that I'm a professor of infectious diseases, but also I worked at the very beginning of the pandemic, in the very core of the disease in Italy, as a member of the Italian Civil Protection, the task force of the Italian Civil Protection against COVID-19. So I was in first line against this awful virus. The experience was very hard. And I just want to remember you a few dates, fundamental dates. On the 31st of December 1999, there was the admission of the first cases of COVID-19 by one. In 10 January, the new virus was already recognized and identified and sequenced. And then on the 10 days later, the virus was known to be transmissible by person-to-person transmission, which is something that was unexpected being a coronavirus, not super expected. On January 23, one began the first lockdown. 60 million people were locked down. This is the first extraordinary decision in the history of humanity. A few days later, the first Italian cases, and a few days later on, Italian government decided to start the lockdown without any issue to how to cope and to control the spreading of the infection. And then in March 11, WHO declared the pandemic state. But what is most astonishing is that few days, less than 1 week later, the first vaccine trials were started. Something never happened in the history of human beings. In June, the first drug that was really found to be effective in spite of all our efforts to find something useful was dexamethasone, an old drug that was shown to reduce mortality in patients who were in need of oxygen supplementation. At the end of October, the second terrible wide wave of coronavirus started in Europe, and at the half of December, 14 December, the first COVID vaccine was approved officially by WHO and FDA. So these are the milestones of this terrible disease, and these are the numbers up to date. 2025 million cases confirmed worldwide, 4,600,000 deaths all over the world, and as of September 13, 5.5 billion vaccine doses have been administered to people all over the world. These are 4 waves. The first one that really shocked us, because we were the first Western country severely hit by this coronavirus, and seemed to us an extremely alarming condition, compared to the second wave, was something really small, but nevertheless it shocked us, it scared us, it put in serious difficulties the hospitals, also because many doctors and nurses were affected, so they were not in charge anymore. So we had shortage of human power and shortage of hospital beds and shortage of ICU beds. The summer passed away without any complications apparently, but then the second terrible wave, as for pandemic influenza, the second one was the worst, occurred. We had in Italy more than 40,000 new cases every day. We are 60 million, so it's a very high percentage. Then slowly it decreased, also because vaccination started by the end of December. And then the third wave that peaked in March, and then again the slowly decrease up to the fourth and milder wave, apparently, that culminated in the end of August and now is getting down and down. And this is the more detailed curve that we have examined after the introduction of the vaccine campaign in Italy. As you see, the fourth wave is smaller compared to the third, and much smaller compared to the second one. Only 7,000 cases all over in the peak level, and only at the moment we are at less than 5,000 cases every day. These are the vaccination in relation. Not maybe one is passed. Okay. But we started the vaccination of the population, and these are the numbers. At the moment, 40 million people have been vaccinated. 37 of them had a double dose. The problem is that 2 million people had been vaccinated more than 6 months ago. And since we started a campaign that included the most vulnerable persons at the beginning, because we wanted to protect them mostly, and mostly we wanted to prevent the disease to become severe, as it surely happens in more vulnerable people. These vulnerable ones have been vaccinated more than 6 months ago. Myself, I have received my first dose in December the 27th, and that's, but I'm not vulnerable, of course. But nevertheless, we have a concern regarding the strategy of behaving with these patients. It's interesting to know that the majority of oldest people, 80 years older or older, have been vaccinated, and more than 92% received the second dose of vaccine, and the decrease in percentage of persons who have been reached by the full vaccination is not a problem at the moment. It's not of concern for us because they are the less vulnerable ones. But what I really want to point out is that there is a kind of resistance to being vaccinated, because it's under the eyes of everyone that people who have been vaccinated can be infected and can be severely also affected by the disease. But if you look at this slide, these are our numbers, and you see the pink column, which are the fully vaccinated persons. Even among the oldest one, older than 80 years, you can see that the fully vaccinated person represents a small, tiny minority of the persons who have been infected, who have been admitted to hospital, who are admitted in intensive care units, and who die. Therefore, the vaccine, even in the presence of a large majority of variants due to the variant Delta mostly, our concern about the efficacy, effectiveness, and safety of vaccine is not absolutely confounded by this data. It's supported by the evidence that vaccination protects against infection, protects against the severe infection, against death. Of course, we are in a small concern because after summer we had a decline in the total frequency of vaccine administration. It's physiological, I could say, because in summertime people are mostly displaced by holidays, vacations, and so on. And this is the most resistant target to be reached by vaccination, because most of the people who have not been vaccinated earlier are resistant to be vaccinated. So we have to make any strength, any effort to reach all those people. We expect to achieve the so-called herd immunity, more than 80% of people vaccinated in the total 60 million persons in Italy, by the end, by Saturday, 13th November. This is our target according to the frequency and velocity in which, and the speed in which we reach people to be vaccinated. But if we increase the pace, we could also do better. We don't know if it will be possible or not. Few words to the variants of concern. As we know, there are four variants of concern. The most important one of those is the so-called Delta variant. But now another one, which is only a variant of interest for the moment coming from Colombia, is the Mu variant, seems to appear as a possible threat for our safety. What can we do? Of course, including some of these point variation, point mutation inside the new vaccines could be a good strategy to protect further the new vaccine recipients. But this is something we cannot expect at very soon pace. We do some obvious strategies to control and to contrast the diffusion of variants inside Italy, and I've seen that Pakistan too is making a great job to prevent the spreading of these new infections, new variants. And I thank you very much for your
Dr. Gulia Italiani to have given us the time and to have talked to us about the strategy that Italy, of course, put into place in order to not only vaccinate their public but also to prevent the spread of COVID-19, and of course to have talked about the different variants as well. Now I'd like to invite the President of Institute of Regional Studies, Ambassador Nadeem, on stage to present some token of thanks to the participants.